Your dog licked their paw this morning, and you smiled, looked away, and kept scrolling. You have probably done that 100 times. Because that is what dogs do. They lick. It is quirky. It is harmless. It is just one of those dog things. But here is what nobody ever told you. That lick, the one you just ignored, the one happening right now on the other side of the room, might be the only way your dog knows how to tell you something is seriously wrong. And the window to act is closing. Most owners only find out their dog was in medical distress after weeks of watching a behavior they assumed was nothing. By the time they get to the vet, the condition has had months to develop. And the vet says the same thing every time. The signs were there. They were just never read. This video is going to change that. There are 7 signs that your dog's licking has crossed from normal behavior into a medical signal. Number 1 will reframe every single licking moment you have ever dismissed. And number 7 is the one most owners never connect to licking at all, until it is too late. Stay with me. Welcome to PAW'S Mind. If you are new here, subscribe right now because this channel goes deeper than behavior. We decode what your dog is actually trying to tell you, including the things they can only say with their body. There are 7 signs to cover. They are not all obvious. Some of them look exactly like normal licking to an untrained eye. But there is a line between a dog grooming and a dog asking for help, and every sign on this list is on the wrong side of it. We are starting at number 7 and ending at the one that changes everything. Number 1 is the sign most owners have watched for months without understanding what they were seeing. Sign number 7. Licking that always targets the same single spot on the body. Most owners see their dog licking one area repeatedly and think it is a preference. Maybe they like that leg. Maybe the fur just tastes interesting. Maybe it is nothing. Here is what is actually happening. Dogs do not lick with habits. They lick with purpose. When a dog returns to the exact same location on their body dozens of times per day, they are not being quirky. They are responding to a sensation coming from that location. Pain, itching, inflammation, heat, pressure from beneath the skin. Something in that spot is producing a signal, and licking is your dog's only available response to that signal. The clinical term for this is acral lick dermatitis when it reaches its advanced stage, but it almost always starts the same way. One spot, persistent, dismissed. What most owners miss is that the initial skin surface looks completely normal in the early stages. No wound, no redness, nothing to see. So they assume nothing is wrong. But what drives the licking is almost never a surface problem. It is something beneath. A joint aching from early arthritis. A nerve that is being compressed. A tumor developing in the underlying tissue. An insect sting that penetrated deep. The licking is the map. The spot being licked is the location of the problem. Research published in the journal Veterinary Dermatology found that dogs presenting with focal repetitive licking had an underlying orthopedic or neurological cause in a significant proportion of cases that had initially been dismissed as a skin issue. The skin breaks down later as a consequence of the licking. It is not the origin. If your dog is licking the same spot every single day, that spot deserves a veterinary examination. Not because the skin looks bad, because something beneath it is producing enough discomfort that your dog cannot stop responding to it. But that is only the beginning of what repetitive licking can mean. Keep watching because sign 6 is the one that catches owners completely off guard. Sign number 6. Licking the air, the floor, or surfaces with no food present. You have seen it. Your dog is just lying there and suddenly starts licking the carpet. Or they lick the couch cushion. Or they stand in the kitchen and lick the air in slow, rhythmic movements for no apparent reason. Most owners laugh at this. It becomes a personality quirk. A funny little habit. A video for the family group chat. It is not a quirk. Dogs possess a secondary sensory organ called the vomeronasal organ, located in the roof of the mouth. Air licking and surface licking can serve as sensory intake behaviors, directing molecules toward this organ for deeper chemical analysis. That is the normal version. Brief, situational, connected to a smell or taste in the environment. What you need to watch for is something different. Persistent, unprompted, rhythmic licking of surfaces or air that cannot be explained by anything in the environment. This specific pattern has been documented as a primary behavioral indicator of nausea in dogs. The licking stimulates saliva production and creates minor temporary relief from the sensation of gastric discomfort. Your dog is not tasting the floor. Your dog is managing what feels like a permanent low-grade wave of nausea. The conditions behind chronic nausea in dogs are wide-ranging and serious. Gastrointestinal disease, liver dysfunction, kidney disease causing uremic nausea, bilious vomiting syndrome, intestinal obstruction in early stages, certain medications, vestibular dysfunction, which produces a constant sensation of motion sickness. A study published in the Journal of Veterinary Behavior found that dogs presenting with what owners described as excessive surface licking were significantly more likely to receive a gastrointestinal diagnosis compared to the general dog population. The owners in the study had been watching the behavior for an average of several months before seeking care. Surface and air licking that happens daily, in long sessions, without an obvious trigger is a signal your dog's digestive or organ system needs to be assessed. Not monitored, assessed. And remember what I promised you about number 1. That 1 reframes everything. Stay with me. Sign number 5. Suddenly licking a specific area immediately after returning from a walk or outdoor time. Your dog comes in from outside. Before they do anything else, before they drink water, before they greet you fully, they go directly to one area of their body and begin licking it with focus and urgency. Most owners watch this and think the dog is just cleaning themselves. Normal post-walk grooming. Here is what is actually happening. Dogs have highly sensitive skin and an extraordinary ability to detect localized sensation. When a dog makes a beeline for a specific body part the moment they come indoors, they are responding to something that just happened to that area outside. A thorn that has not yet penetrated fully. A foxtail beginning to burrow. A tick that has just attached and whose saliva is producing a local inflammatory response. A contact allergen in the grass or soil that has activated an immune reaction in a specific patch of skin. An insect sting. The danger with this sign is the window. Foxtails, which are grass awns common in many regions, do not stay put. They burrow directionally and they move through tissue. What begins as a paw lick can become a foxtail that has traveled into the paw pad, through the foot, and up the leg within days. Ticks in early attachment are small enough to miss visually and are best detected in the first hours when removal is both easiest and most medically important. Veterinary emergency practices document foxtail and tick cases consistently, and the pattern of owner reports is almost identical every time. The dog kept licking one spot after walks for a few days. The owner thought it was nothing. By the time they came in, the foreign body had migrated or the tick had been feeding long enough for complications to develop. If your dog comes in from outside and immediately, urgently targets one location on their body, that specific location deserves a physical examination within that same day. Part the fur. Look at the skin. Check for anything embedded, attached, or inflamed. If you cannot identify a cause, call your vet. Sign number 4. Licking that intensifies or begins at night and disrupts sleep. Your dog settles for the night. You fall asleep. And somewhere in the early hours, you are pulled back to consciousness by that repetitive wet sound. The licking is happening again. You reach over, tell them to stop. They do for a while. And then it starts again. Most owners chalk this up to the dog being restless, or having skin that bothers them at night, or just being strange about sleep. Here is what the nighttime timing actually tells you. During the day, your dog has stimulation, movement, sensory input, interaction, activity. These things compete with and partially mask the sensation driving the licking. At night, when the environment goes quiet and there is nothing else demanding attention, the underlying sensation becomes the loudest thing in your dog's experience. The licking that happens at night is almost always more severe than whatever was happening during the day, because the day was providing interference that is now gone. This is particularly associated with 2 conditions. The first is allergic hypersensitivity, specifically environmental allergens that accumulate in bedding and indoor air. Dogs with atopic dermatitis frequently show a significant worsening of itch-related licking in the late evening and overnight hours. The second is neuropathic pain, where nerve-related discomfort follows daily activity patterns and peaks during the rest period. Research published in Veterinary Dermatology found that owner-reported nocturnal licking was one of the highest correlation behavioral signs for underlying allergic skin disease, and that dogs presenting with this symptom showed earlier and more complete treatment responses when caught within the first 3 months of the behavior's onset. Nighttime licking that is disrupting your dog's sleep or yours for more than a week is not a sleep quirk. It is a daily symptom you have been sleeping through. And before we go further, I want to remind you what I said at the beginning. Number 1 is the sign that changes everything. The one that will make you understand every dismissal you have ever made. We are almost there. Stay with me. Sign number 3. Licking another animal's ears, eyes, or wounds with unusual frequency or obsession. You have a multi-pet household and you have noticed it. One of your animals is fixated on licking the other. The ear, the eye, a spot on the skin. Over and over in long sessions with an intensity that seems more than social grooming. Most owners find this sweet. Pack bonding. The animals taking care of each other. Sometimes that is true. And sometimes your dog's nose has already found something your eyes have not. Dogs possess olfactory capability that is between 10,000 and 100,000 times more sensitive than a human's. They can detect infection, inflammation, cellular change, and metabolic dysfunction through scent before any visible symptom exists. When a dog focuses obsessive licking on another animal's ear, they are frequently responding to a bacterial or yeast infection developing in that ear canal, which produces a detectable odor change before it becomes visible or painful. When they lick another animal's eye persistently, they are often responding to early conjunctivitis or an irritant that has produced a detectable chemical change in the discharge. When they lick a specific spot on the skin of another animal, that spot frequently has a developing lesion, abscess, or growth beneath it. Animal behaviorists document this phenomenon consistently and note that owner-reported cross-species licking behavior, when it escalates in frequency or targeting, is often the earliest indicator of a health problem in the animal being licked, not the one doing the licking. If one of your animals is persistently and obsessively focused on licking a specific location on another pet, that location warrants a veterinary examination. Not because you can see a problem, because your dog already can. Sign number 2. Paw licking that has changed in character, frequency, or the number of paws involved. Almost every dog licks their paws to some degree. This is the sign that gets dismissed the most reliably and the most consistently of anything on this list, because it looks so common. But there is a version of paw licking that is a medical signal. And the way you identify it is by understanding exactly what changed. A dog that occasionally licks one paw briefly after a walk is grooming. A dog that now licks all 4 paws every evening for 20 minutes. Or who has developed reddish-brown fur staining between the toes. Or who is licking with a frantic urgency that they cannot be interrupted from. That dog has crossed a clinical line. The reddish-brown staining is one of the most important visual markers that most owners never connect to anything serious. That color is produced by porphyrins, compounds in dog saliva that oxidize on the fur with repeated prolonged exposure. If you are seeing that discoloration between your dog's toes, what you are looking at is the evidence of weeks or months of persistent licking in that location. The fur is recording what you missed. The conditions that produce this pattern include food allergies, which frequently manifest first as paw licking before progressing to broader skin involvement. Environmental allergies to specific grasses, pollens, or molds that are absorbed through the skin of the feet. Contact hypersensitivity to lawn treatments, de-icing salts, or cleaning products your dog walks across. Interdigital cysts, which are painful nodular growths between the toes that cause relentless licking behavior. And yeast or bacterial infections of the skin folds between the toes, which produce both itching and a detectable smell. Research published in the Journal of Small Animal Practice found that paw licking presenting with interdigital staining had been occurring for an average of several months before the owner sought veterinary care, and that earlier intervention significantly reduced the duration of treatment required. If your dog's paw licking has increased in duration, frequency, or urgency over the past several weeks, and especially if you can see any fur discoloration between the toes, that is a veterinary appointment this week. Not an emergency for most presentations. But not another week of watching it either. Sign number 1. Your dog is licking you more than they ever have before, specifically in the same place at the same time with the same quiet focus. And you think they are just being affectionate. This is the one I have been holding back. Because it is the most important and the most misunderstood sign on this entire list. And when you understand what is actually happening in these moments, you will never dismiss them the same way again. Your dog has been licking you their whole life. Your hands after dinner. Your face when you come home. Your legs when you sit on the floor. You have always understood this as love, as greeting, as habit. And most of the time that is exactly what it is. But there is a specific pattern of licking that is something else entirely. It is slower, more methodical. Your dog returns to the same location on your body again and again, often with their eyes partially closed and their focus complete. They may do it in the evening when the house is quiet. They may do it after you have been still for a while. They may return to the same spot on your arm, your leg, your face, on consecutive days with a focus that is different from their usual affectionate licking. Most owners feel touched by this. They assume their dog is just being loving, extra loving, the sweetest version of themselves. What some of these dogs are doing is something that has been documented in formal medical research and that most owners are never told. Dogs have been demonstrated in peer-reviewed studies to detect specific volatile organic compounds produced by abnormal human cell activity. A landmark study published in BMC Cancer found that trained dogs could identify cancer-positive breath and urine samples with a degree of accuracy that significantly exceeded chance, and subsequent research has documented spontaneous detection behavior in dogs with no formal training at all. Research from the Medical Detection Dogs Organization and affiliated academic partners has confirmed detection responses across multiple cancer types including breast, colorectal, bladder, and skin cancers, as well as preclinical detection of diabetic episodes, Parkinson's disease, and certain bacterial infections. The dogs in these cases were not trained. Their owners reported that the dogs had begun focusing persistent, unusual licking behavior on a specific location of the owner's body weeks or months before any diagnosis. The owners had interpreted the behavior as affection. This is not a reason to panic every time your dog licks your hand. Most licking is exactly what it looks like. But this is a reason to pay attention when the pattern changes. When your dog, who has always been affectionate, begins returning to one specific location on your body with an unusual, methodical, focused intensity that feels qualitatively different from their normal licking, that change is worth noticing. It is worth mentioning to a doctor if it persists. Not because it is a definitive diagnosis, because your dog's nose is the most sophisticated chemical detection instrument in your home, and it has been aimed at the same location on your body for 3 weeks. Your dog cannot make you a doctor's appointment. They cannot explain what they are detecting. They cannot tell you the location, the urgency, the nature of what they have found. All they can do is stay there. Keep coming back. Keep licking the same spot with that quiet, complete focus. They have been trying to tell you something. So the next time your dog comes to you when the house is quiet and begins licking the same place on your body with that steady, methodical attention, know what you might be witnessing. Not clinginess. Not boredom. Not a habit. A dog using the most sophisticated instrument they possess. Their nose, combined with the only physical gesture available to them, to tell the person they love the most about something they have no words for. Every one of those moments is a question. And the question is not about love. The question is about you, about your health, about whether the person who is their entire world is okay. That is not a dog being affectionate. That is a dog doing the only thing they can. Staying close, paying attention, and refusing to stop pointing until someone listens. You now know something most dog owners will never know. Licking is not just a habit. It is a language, and 7 of its dialects are calls for help. Some from your dog, and one, perhaps, meant for you. Share this with someone whose dog has been licking more than usual and who has been telling themselves it is probably nothing. It might be the most important thing they see today. Subscribe to PAW'S Mind. We go this deep on dog behavior every week, because the conversations happening between you and your dog are more important than most people ever realize. And if your dog has started following you into specific rooms, lying against your legs in the evening with that same quiet focus, there is a reason that goes much deeper than companionship. That video is next.